Well, vector-borne diseases is a big topic, and the elephant in the room for that topic is Lyme disease. And about half of the hour that I had, I spent on Lyme, and the vector, of course, is the Oxodes tick. And a sizable chunk of that was on the misunderstandings and origin of those misunderstandings about what Lyme disease is and what Lyme disease is not. They will see physicians or other healthcare providers who will tell them pretty much 180 degrees the opposite of what I'm going to tell them. And they're sort of stuck in the middle, not really knowing whom to believe. And I understand that, and I don't fight with them about it. I don't argue with them about it, and it doesn't get you anywhere, and certainly raising your voice doesn't get you anywhere. But I do try to explain to them that that real Lyme disease, at least my concept is, the bug isn't from Mars, it's not from another dimension, it's just another bug, it's easy to diagnose, it's easy to treat, and there is no credible scientific evidence that it produces a chronic infection with chronic symptoms the way a lot of people have been labeled. And there's even, in addition, there's no credible scientific evidence that repeated courses of antibiotics does anything to improve those chronic symptoms. But it's not the patient's fault, nor does it imply that their symptoms aren't real. It's just that they're not due to ongoing infection with Borrelia burgdorferi. You can get Lyme disease more than once. It's not unique to that infection. There are many infections we don't have good immunity for, and we can get them more than once. Syphilis would be an example. In fact, a cousin of Lyme disease. But what a second infection does not represent is failure of treatment of the first infection. It's not a relapse. It's you got it again, and that's not surprising. Most people that live in Lyme areas live in Lyme areas, and they are exposed more than once. So it's not unusual to get it again, but the treatment is the same. It's a short course of doxy, and you're cured. Again, it does not produce this syndrome associated with all sorts of chronic symptoms, fatigue, headaches, memory difficulties. Again, those symptoms are real for these patients, and blowing them off that they're not real is not therapeutic, nor sympathetic. But more antibiotics is not the answer. The start of the answer is trying to make them understand that more antibiotics is not the answer, and and there are plenty of examples of people who have had serious consequences of protracted courses of antibiotics, and some fatalities, in fact. So the first part of that is getting them out of that mindset. And as I said, it's not easy, and I don't envy the patients who are trying to sort out whether they should believe me or they should believe other physicians who are going to tell them something else. Well, you can decrease it by using proper insect repellents and insecticides. And with Lyme, it's particularly easy, in quotes, to prevent, because the tick has to feed for at least 36 hours on us before it can transmit the bacterium. So if one is out during the daytime in a tick potential area, a good tick check at night is all you have to do, and you won't get Lyme disease if you pull off the ticks.